Barsana, an ancient holy town of North India, 150 kilometers from Delhi. Its villagers live simply, but illiteracy and poverty prevail. Access roads are poor and public transport irregular. Medical facilities are scant, and 30,000 people in the area have no access to a hospital. Even then, the average family income of $25 per month could not provide the most basic care. Cataract, the leading cause of blindness in the world, is a problem that affects not only the elderly, but also the young. Totally or partially blind, many villagers lead dependent and unfulfilled lives, unable to afford 3,600 rupees or $80 for a cataract operation. Barsana Eye Camp, organized by the Bhaktivedanta Hospital. Every year since 1992, Bhaktivedanta Hospital has organized a free cataract surgery camp for the villagers of the Barsana area. The volunteer staff have a sterling reputation, and each year thousands arrive seeking help. Willing to wait for up to 3 days, villagers come by all means of transport in the hope of restoring their vision.
Way back in 1989, we had just come to study the medical situations here with some doctor friends. And we were very overwhelmed to see the poverty. And there was one medical center, quite a nice structure, but not a single doctor coming even once in 15 days. And the pharmacist looking after the patients, giving injections and giving intravenous medications and admitting them and discharging them. Very miserable situations. So we had an eye surgeon amongst them with our friends. So we thought why not have an eye camp here? And the idea fructified, and in 1992 we organized the first cataract medical camp here.
An initial examination is performed at the entrance to the camp. The staff thoroughly examine the patients to determine who will undergo surgery. Those with no cataract are led to a dispensing area where they are given free medicine and advice on its use. Those with cataract are more thoroughly examined with the most modern scientific instruments. With the help of a retinoscope, the condition of the retina, the optic nerve, and blood vessels are evaluated. Intraocular fluid pressure is tested, as well as the blood for diabetes. Internists check their general health. Finally, the ophthalmologists analyze each patient's information and decide who qualifies for surgery. Anesthesia is given to the eye 1 hour before the operation. Only the finest microscopes are used. 10 highly qualified ophthalmic surgeons from Mumbai each spend 12 hours a day performing operations and examining patients in the wards. Skilled staff spend the night preparing the operation theater for 16 continuous hours of use every day.
The features of this camp, which are different from other eye camps, is that we are operating at a hospital setup. The equipment that we have to examine the patients before surgery and after surgery are the same that I use in my own clinic in Bombay. The operative setup is excellent. We are using state-of-art equipment to operate these patients. The most important thing being that the sterilization protocols that we are following here are the highest that we know of, and I feel that I would not mind operating my own parents here should they require surgery in the coming years.
After the operation, patients are given a meal and then rest. All amenities are provided during their 2-day stay at the camp. The following morning, bandages are removed and the patient's vision checked. 2 hours later, their vision is more thoroughly analyzed. Special care is provided for those needing further assistance. Patients are given 40 days of medicine, dark glasses, and a blanket.
ठीक बनी आपकी आँख? हाँ? रोटी वोटी खूब खाई? कोई कमी नहीं है किस चीज़ की? कोई बात नहीं। तो कृपया करके बाहर बता दीजिए।
परसों तो मैं राधा रानी पे पहुंची रही मैं कि मेरी 8 बजे
जा बन गई ना फिर अभी राधा रानी के पास से।
6 साल से नहीं दिखे वो साहब और अब वो दिख रहा है। अब बड़ी खुशी है और गांव में भी जाके अपने में यूं ही कहूँगा कि भाई 6 साल से ना दिख रहा वो दिखने लगे खूब।
In this day of advanced medicine and surgical techniques, no one should live with a disability of partial or total blindness due to cataracts. The doctors and staff of the Bhaktivedanta Hospital give their precious skills and time. In return, they receive satisfaction that only comes by selfless service to others. Please join us now in working together to make a difference in their lives and in ours as well. Let them see.